Hi, everyone. Welcome to Beauty Cult Canada's Watch and Learn segment. We're excited for 2026 and bringing you monthly topics and maybe demonstrations, that type of thing. My name is Suzanne, and I'm the Director of Education and Training here at Beauty Cult Canada. And I think most of you know Tara.
I've been on social media a little bit this past year. I'm Tara, and been doing this since 2008, the distribution part of it. So kind of on the fly, educating myself as we go on everything that we bring in.
Always trying to collaborate and come up with stuff. So I just have a little bit of notes so we make sure that we're following on and staying on time. So today's session is all about the Doctor Pen and what's new about it and what this device is. We're really excited by it. It's taken a lot of time and patience and research trying to get a device into our hands as professional estheticians, and that it's actually Health Canada approved. So I'm going to, one more thing before I should mention, if you are taking this and you need this for your CECs, your Certificate of Continuing Education, let us know. We're happy to give you a certificate after. You just need to email us and let us know. Or if you just want one just to show in your treatment room that you're keeping up with workshops and continuing education, it's always an add-on if you're running your own business and you're trying to find ways to keep up with the things going on out there. All right.
I'm really excited about this because Health Canada approved and inexpensive in comparison to other ones that are on the market was huge, because this is by far my favorite treatment to receive out of anything.
So tell us, how did you come across this? Because I know you were telling us quite often, I found this one and now this one, and then there's that one. Oh wait, can't have that one into Canada. And I don't know if you guys realize the background on bringing devices in, I will say, with the proper process and policies and procedures at Health Canada, and as a distribution center, Tara has to follow those, along with us as professionals bringing devices into our treatment room, because it all falls into your insurances, which we can talk about at the end if you want, but we're just here to talk about the device and what's all about it.
So yeah, this device is Health Canada approved. There's only one tip, one cartridge. It's the H14 that is also Health Canada approved along with it, but it's inexpensive. So this procedure, microneedling or nano needling at a more minimal depth, can be added on to your facial already. It can be used in so many different ways. And when I heard from people that were saying, oh, I bought this $5,000, $6,000, $4,000 machine, and the tips are each $40 to $60, that your cost of goods goes up. So your treatment then is exclusively that treatment. It can't be an add-on because it gets expensive when the product cost just on the tip is going up to that. So we wanted to get something that is more versatile. So I heard from people that said, I will never get my money back out of my machine because nobody wants to pay the amount of money that I need to charge for the treatment in my set clientele. And also because they had seen so many kind of horror images online that they don't want that treatment. And then, what was I going to say? We just heard so much negative feedback, and we did look into some other devices, but then there was exclusivity with them. And I think some have GPS on them, so they're tracking where you're going with it. And then
how if you take it, using it, right?
Yeah, and if you're not continuing to buy the supplies from them, if you take it outside of your facility, then are you waiving your warranty on the device? Because now they won't warranty it, that it's been, like, if you take it home to use it on yourself one night. And then also we had women that were spending $300-400 to have the microneedling service, but then they said, my niece or my kid was cutting their arms in their teenage years and I'd like to have some scar revision done, but the treatment is so expensive to be doing it on somebody's arms or legs that they kind of, it wasn't available to them. So that's why we wanted to have a device and the cost of goods of the service to be inexpensive so that you can offer different. So if you're specifically just doing microneedling, you can have that treatment, but you can add it on to a facial. And we're going to talk about that today.
Protocols and treatments after. All right, so let's grab the device and let's talk about it.
It does look very swanky. So it comes with this little stand. It kind of reminds me of our freeze pen on the stand. And they were saying in the marketing, oh, and doctors like to set it right on their desk and how nice it would look. Anyways, this is the device. The cartridges that come for it are the A20. It goes from 0 to 2.5. On the face, you're going to hear us kind of recommend that we don't usually go over the 1 millimeter depth, and what we're going to do today won't be to that depth because we're going to do it without numbing. It's kind of a rubbery thing. Inside the machine itself, it comes with sleeves to put over it, so you kind of have a good grip on it right there. And if you're using it like a pen, it's not very fat at the end, which is what we liked. We looked at some other ones that were fat or more like a tattoo device, and we thought this one would be more comfortable.
Ergonomically, a lot easier on the hand if you're doing treatments back to back.
Yeah, and the charger end looks like the newer iPhones. This is the end where you would put the tip in, and if you've seen more inexpensive devices, this one has more of a metal inside, so it's definitely an upgrade from the others that are on the market. Dr. Penn's been around for a really long time. Almost every style of device has different tips that go on the end.
Maybe hold it over the middle, they can see it better.
There.
Yeah.
Every style of device, the tips don't match each other. So the one thing with this one is there's 2 other devices that are also Health Canada approved, and this same H14 tip does fit the 3 different devices. I'm pretty sure there's some knockoffs on the market, because if you're buying it from the manufacturer that has the licensing, there's a set value that you're supposed to charge for it. So if you're seeing it really discounted, it's not coming from them.
Yeah, they've kind of controlled that. Basically, when Tara got this in, it was like in order to have it, you would have to charge it this price.
And I did actually have Health Canada reach out to me and say, are you getting it from this specific manufacturer? Otherwise, it's not. So I think there are knockoffs. We're going to show you installing the tip, because we've already had kind of a troubleshooting. The same
in this
insert, we've seen it on other devices. So it's got like a 3-prong inside the.
I'll bring it up closer to the
tip, and then it's got 3 little hooks where it's going to get hooked onto. But because this is metal and that's plastic, if you force it, you can hear it crack, and then it might pop out on you. So you want to be delicate with it on the insert, and then you have to give it a firm twist, but you want to make sure it's lined up before you do that.
We'll show it when we're doing the demo too, because it's almost like there's like a 3-prong, and underneath it's like a puzzle. So when you put it in, it should drop in and then turn, so it's locking it inside.
I'm going opposite direction. Is that great?
Yeah, that's okay. But yeah, we'll show that during the demo itself. The other thing about the cartridges too is that it has its backflow is set up within the cartridge, on each cartridge.
Yeah.
And they've designed it a little bit differently now. You may have seen this if you've been doing microneedling. You'll see that there's little waves in the tip itself. I don't know if you can see that. I'll just rotate it against the white. Whereas before it was completely flat. So they've redesigned the tip to allow it to not have that suction, I would say, so it's not coming up through your cartridge anymore. If you've ever had that happen when you're working with it. So it allows the air, so it will actually help your product penetrate a little bit better too. But yeah, that's the other thing, really simple to use.
Yeah, and then on all the cartridges, what if you have your Health Canada safety inspector come in, they're going to look for the dates on the cartridge. That's important. And actually, you should rip this off and staple it to your intake form, your client's intake form, and keep it.
Yeah, it should, whatever your bookings are, I'm not sure what province or state you're in, but here in Alberta, we have to keep this. And what we do is we actually date it so that it matches the client that we're working on, and we staple it to the client form. And then where you're writing out the treatment, you do the same thing. So anything that has the number on it, the DIN number, is that the correct word I'm looking for? I forgot the name of it right now, but.
No, it's not a DIN number. It's just a lot number.
A lot number, that's
batch.
it. Yeah, a batch number. They will want to see that for every time you use it.
And
so just keep that in mind. And the date was used. So this should match the same date as your client's date of treatment. And they will look through your book. If you've not had this done, if you're in, I know in Edmonton specifically, they are now caught up on a few things after the shutdown many years ago now, but they're now going through randomly and calling up a lot of the beauty technicians out there and coming in for inspections. So
their goal here is be in a different salon every 2 years. So before, when we had a salon, we had them come in when we opened and we never saw them again. And then now, yeah, people who got checked 2 years ago, they're getting randomly called and checked again. So they're trying to be more consistent with their checks.
Yeah. But anyway, so with this, and if you have questions, like reach out to us. We kind of know most of Canada's regulations because we're across Canada too. So with microneedling, one thing to keep in mind is the device itself and when we're working with it. So the other thing on here that you can turn up the speed to 6 different levels. So if you're newer at microneedling, maybe you're going to go a little bit slower till you get the actions. And then if you're looking that you're more confident with it is when you would turn up the speed. So there's 6 settings on the speed on this one. And like Tara said, super lightweight. The other thing when we get into microneedling, just generally we'll talk about it. If you are currently doing microneedling, you've been doing it for several years, I'd say over a year for sure. 2024, we're in the new year now, but take a look at what's going on. There's a lot of changes that have happened. We've read this book from, I forgot how many years ago was that? Anyways, the name of the book was from a Canadian doctor, and he's talked about this as well. The number and the gauge that we're going, like the depth that we're going, and the purpose behind it. So what we've noticed, and we keep sharing these things that we find online, we send it to each other, that the depth isn't necessarily better going into the higher numbers. So because the results behind it, most people are doing it for the rejuvenation, the cell renewal, to boost the collagen and elastin, the fibroblasts. So you think more is better. The research is saying it is not making a difference. So why do the trauma to the skin? So when you see the red marks that are left behind, I think before they would say that was acceptable for the treatment. Now they're saying that's not. Unless you're going medical grade, you're in under a doctor or medical director and their treatments are designed for specific things, that's different. So we're not talking about that level. We're talking about our scope of practice as estheticians, facial technicians. And if you are able to have a medical license to do higher, like you're allowed to do that, then that's not what we're talking about today. Yeah, then you have a different insurance too. But if it's like Suzanne's medical day spa, because you can name it whatever you want, but it doesn't mean I'm a medical esthetician able to go over a 1 on this device. Or the pinpoint bleeding that people are searching for, there's still a lot of training happening. They're not adjusting to this new way of, I guess you could say, doing it, because they're actually saying that's not doing anything more to the skin than me doing a 0.3 or 0.5. Okay, so take a look at whose skin you're working on. What's the goal behind the skin? So like Tara and I, with our skin, okay, there's not really scarring. I have a scar up in here that maybe I'm going to have her do. Yeah, too much. I'll have her go maybe a little bit more depth on there, but that depth on the scar is not the same on everywhere. Whereas I'd say a few years back, people were going, I'll say hard at it, thinking more, better, let's get it, and then left with these track marks and that's actually damaging the skin. That's not promoting the goal behind microneedling.
The skin is going into post-inflammatory response. It's not going into mend itself response.
Yeah, the collagen that we're after, that we want to rebuild. Yes, we're damaging the skin under the layers, but not, think of it like a chemical peel. That's the purpose behind it too, is to rejuvenate that skin, but we're not going in and
overdo it.
Yeah, you're going to have
scar tissue. We don't want that. We're trying to treat that, not cause it.
Yeah. So when it comes to generally, I would say our world about microneedling is all about the pro-aging, slowing down the aging and trying to help with it. And then you are going to have some targets of acne, skin that had left acne scarring. So in order to be doing that treatment, all of the acne area must be cleared and no more breaking out and healing on its own, because you might have that adverse effect as well. So I always think less is more. I think that's my word all the time, actually.
And we've been following so many dermatologists and stuff, and they're all saying the same thing. So this isn't just coming from
it's coming out of the UK, Australia.
It's coming from every
and now
every
North
level.
America. And North America, more doctors are actually coming out. Whereas following them 2 years ago to what they said and what they're saying now, they're saying, you know what, it's actually not better. And again, unless you're targeting scar tissue, that's different skin we're talking about, right? And age too, like having young people doing this like in their 20s. The purpose behind that would be, is it necessary to do at that age?
Yeah. That's not what you're treating on a 20-year-old.
Yeah, exactly. So that's kind of the depth. So usually I think too, if you're not sure, maybe you're new at this and you're just investigating, like you're looking like, I don't know if I want to do this, because we've had people say, I'm not sure, I really want to do it, but I'm scared to do it because of the things they've seen online, which I can appreciate. I always thank them for that. That's good. Do your homework.
That was my first experience. I'm like, I'm never doing that, and I'm never having it done.
Yeah, it's like, what would that be done to your face? But anyways,
and the person doing it couldn't answer any of my questions. Why are you doing that?
So if you're ever gonna get into a device, I always tell professionals when they're buying a device, who's training them on the device? Are you going to get training? That's another thing. We have actually done training for people on microneedling on different devices, not the ones we even sell, because they're not even being trained. They're left on their own. If you are looking for something, I would suggest taking a course so you really understand. It's a good refresher. The latest and updated ones, find out what type of treatments they offer. So for example, they say nano needling, that's acceptable. If they say like the vampire facial, that's not something that's being done. And if it is being done, it's for the glam of Instagram, I think, is why they're doing some of this stuff. It's getting a reaction for people. But we're here as professionals to look back, take a step back and see the why behind what you're choosing to do. I think that's more of what we should be looking at. What's the goal here? Sometimes the clients want it and they're pushing for it. Just educate them and explain things are changing. This industry, I've been in it for over 30 years, and I love the fact that it's so challenging to stay on top of things these days. It's hard, but that's one thing that I love about it. It's always changing. It's challenging my past training, current training. When we're developing trainings, I'm always looking ahead of, okay, where is this at? How can we make this up to date or the best? What are they saying around the world about this? For example, is it Korea that they're doing eyelids now? We're not doing that right now. But, it's like, oh, that's interesting. Why would we do that? But it's something, not saying no, don't do it, but I don't think there's enough information for us to be training right now. I'd prefer us to do some training to learn the why behind we'd be doing that.
I'd have to listen to a few doctors.
Yeah, and that's what we do. Yeah, follow a few of the doctors that are really challenging
and I think
this.
maybe they're talking about like the hooded eye up here,
not the eyelid.
Movable eyelid.
Because if you look at Korea, what is the eye shape? They're actually, on me, they're doing this part, right? And they're not doing my eyelid, but people say that's the eyelid.
And people in Korea, that's mixed up, and they're doing the tear ducts. Too.
Yes.
We've heard that in the industry, that they were taught to go over the tear duct, which I can't imagine.
When you look at what you're treating, we won't go over any lesions, any acne, any breakouts, healing, bruising, capillaries, broken capillaries. Be very careful, because that, if you think of your windshield and you have a crack in it and you keep hitting that crack, what do you think is going to happen to it? You're probably going to break it more. So you can go around it and hopefully strengthen around the area to help underneath, right? But the other thing is pigmentation, maybe hyperpigmentation, and combined with other treatments. So, but melasma is very deep underneath, and that's a whole other level of treatment. What else? Textures, fine lines is, it helps in the fine lines. Some people are going at a deeper, bringing it up a little bit for deeper lines. But there's so much involved with the skin that if someone is always, doing this and they have the lines in the middle, you can keep doing it over and over. It may help a little bit, but it's the facial expressions are really hard, because that's an ongoing everyday, how many times a day, right? That they're doing that. So just think of not over promising anything, really sit back and think about what it is that you're going to say yes to. What can you not promise them, but help them with to achieve their goals? And then the depth.
The depth is also, are you just doing microneedling, or are you using products other than a heavy molecular weight hyaluronic? Because ingredients matter when you're microneedling. So when you've got all those little microchannels, vitamin C is a no-no if you're going over like a 0.3
Yeah, I'd say 0.3 to be safe.
3, yeah. On the skin, you can actually cause granuloma, which looks like little milia all over the skin. And we got feedback from that too. Somebody did that, was very surprised that it happened. And some say you can't fix it because they caught it right away and did a series of things to try to come back from it. But otherwise, it's really hard to fix. So you're better off not going too deep, or using products you're not sure about.
Okay.
So then I was going to say, because in the questions it's scalp. So
we're going to go through the questions at the end.
I was going to say scalp treatment.
We'll
they're
talk
putting
about
growth ingredients, and then again, you got to be careful with.
Okay, so what we're going to do next is we're just going to give us a couple minutes, because we're going to transition over to the table, to the treatment bed, and I'm going to do a little demo on Tara. Not a full treatment because of time frame, but we'll talk about the areas on the face, how to turn, what to look for, and why you want to do that. And just hang tight, and we will be back as soon as we can.
Okay, lift up. How are we for time? We're good. Oh, is that okay? All right. My favorite part. All right, I'm just getting my gauze, and I'm just going to do a quick cleanse for her, just because of time frame. Tara was kind enough not to wear any makeup today. So we just want to make sure we have a clear, clean surface. So as we're opening up the device, I'll do it this way here, maybe. You can see it. So it comes with a cap on top. I'll put that over my hand like that. So before taking this off, I like to place it in first. So as we drop this in, I'm not going to force it. I'm going to find where it drops in. And can you see how that's moving? That's in then. Should probably do it the whole way. So it moving up and down. Can you see that okay? So once it goes in, there's no friction at all. And you just turn it once. You won't hear a click. You won't see anything. And then I'll take off for the needles. I would suggest to always check your needles by looking under a mag lamp, just to make sure you have no defective. And then to turn it on, right over your face, Tara. So this is level 1. And you can see, and then you can turn your device to where you want it to go. So just because it's demo, we're going to only go to just under 2.5.
No, 0.25.
0.25, pardon me.
So the lowest.
Yeah, pretty much the lowest to get going. It's more
And so
about demonstration.
Yeah, 0.2, you could go under the eye
Mhm.
in this, along the bone here and along the lip line.
So I usually bring a little dish like this of distilled water to the side, and then I'll use my serum. Oh, we didn't talk about the molecular size. Tara, do you want to talk about
The
that?
molecular weight of
Yeah.
your hyaluronic matters.
So as I apply, I'm just going to tell them really quick. I apply it everywhere I'm going to work on. I usually do one side of the face first. And then when I'm working on, if I need to add more liquid, I actually dip into my water and then add. So when you see me do this with the finger, I'm actually grabbing more water to the area. So to work on her, the flat area is the best because of corners. Before I turn it on, I'm just going to explain why. Because when you're working, you can't really see here. So if you can place your arm down and come down to the area, what I like to do is I'll pull up on here to do this area, then pull down to do there. And then I pretty much have the jaw instead of doing this motion across. You don't have as much control. You want to make sure that this is flat to the skin at all times. You're never coming off the edges, coming around a corner. Now you're not in control of how deep your needles are going into the skin and what angle, right? So always work flat to the skin. When you come around a corner, you need to stop. And maybe it's practice, maybe you've got that under control, but if you're new at it, this is just the things that we talk about. Okay. So while that hyaluronic's sitting on her, I'm going to add some water because I want the slip. So on the cheeks, most people can tolerate quite a bit. Any bony areas are a lot more sensitive around the lip and the eyes. So when you're working on it, everyone can see that okay? I'll go up here, maybe you can see better that way. So I'm going to work in a grid. This is more for demonstration. How's that feel, Tara? Mm-hmm.
Feels a little scratchy.
Mm-hmm. What we notice with the 14 gauge versus the 16 is a lot more pinkness happens in the skin. So this is what I mean by lifting. So I'm getting the part underneath, and I don't need to worry about coming around the corners and worrying that I'm not getting every spot correctly, evenly on the skin. As you work your way up, you can go into just below the eye. I don't go right across the lip, but I get into the labial fold in here. So you could do strokes like this if you wanted to. But think of it like microdermabrasion. You're always working in a grid format. You have much more control and much more evenness and pressure when you work in these smaller motions than going across the face. Okay, and then we'll come to center. Now I'm going to add some hyaluronic up in here. Before starting in the middle, this tends to be a lot more sensitive. So think of your nervous system down the middle of the face is always much more sensitive. So I tend to start out here to see how they're feeling with it first. How is that?
I find the bonier areas are always the most sensitive. And I have hardly any skin on my, I have a big
Yes.
forehead, but very thin.
Yes, so the thinner the skin, the more sensitive they're more likely going to be because it's closer to the bone.
But I also have the most lines up there, so.
So I was just going to mention that. So I know Tara, and she always
And I have
says,
big
get in
fat
that area. Yeah. So anywhere there's the fine lines, let me go like that. Is that better lighting? Just realized I could have done that. Yeah, so in here, now she could handle this. So I'm going to go in the center. I'm definitely going to go on those areas that concern her. The first treatment, I would probably just do the one pass. And as I get to know my client, the next time I see her, I'll either up it, or you can do, which we've done not too long ago, is you go at an angle, crosses, horizontal and vertical. You could, if it's a very deep line, do your stamping in it just to add a little more. And here's a little scar from, did you say chickenpox? Yeah. So that can handle more. So you could turn it up a little bit just for that spot, but maybe do that at the end. So you can kind of see the circulation that's happened on the skin.
Oh yeah, do I have any vascular response yet?
Yes, on your cheek. That's why I'm doing one side of your face first. On her forehead, we don't need to do any stretching out. If they've had any permanent makeup done, make sure that you wait before doing the eyebrow area. Depending on how far or how much room I have here, sometimes what I've done, because they don't want the dropping of the eyelid, is I'll pull up so I'm on the bone.
And just like the scalp, if they've over tweezed their eyebrows, going over them will probably help.
So now I'm gonna
Rejuvenate
just
the hair follicle.
lower this a little bit, just a tiny bit. Add a little more water for some good slip. Go. So you can already see. Just gonna turn it so you can see her whole face now.
I was gonna say, John,
Oh,
maybe
I'm
when
gonna
we-
do the lip. I
when
can
we
do
get
your
to
lip
that
too.
side, maybe they can see the eyebrow from that side better.
So lip area. Now, some people will naturally bite down. If they do that, keep in mind, if they let go, you might hit them with the needle a little too deep, and that's when you get pinpoint bleeding. A little bit here and there can happen, but if it's all over, it's just a little too much. So I will still hold, but I'll wipe my glove just so I have grip, and she can still hold if she wants. Let's see how that is in there. It's hard to see that. Just turn that way and let's see if we can get the angle better for you on the camera for our viewers. You can get just at the lip line, but not on the lip. That's a membrane, so be careful. You can go into the center. Sorry, I know you're probably not going to see this very well because it's right in the middle. I'm purposely doing half of her face so you can see the vascular response. So she has a little pustule there. I'm going to go around it. There we go.
Holiday laziness.
Now, some people ask about noses. These are a little tricky to do. So I'm going to get you to lift and turn a little bit more. So everyone's cartridge on their nose is quite different. Tara's is a stronger, harder one. But if they have a soft one, they'll flatten. So be
Oh, mine
careful.
will.
Off to the side, but I meant this way down. Yeah. So I'll pull it this way. Ask them to breathe through their mouth, just in case. There we go. It's very hard to do the center. The tip is very tender as well. You can do it. Are you ready? Mm-hmm. See how I'm adjusting to the corners and keeping it flat.
Can we still see?
Okay, I'm just going to turn that off. So now, if you look at her skin, can you see the difference in the redness of her skin? She has a lot of vascular response through here and here already, and on her forehead, and it can be blotchy because areas are different.
Oh, that's what the neck does.
Yes, and the neck, I can show that as well.
Because the blotchiest and it stays the
Okay,
longest.
we're going to turn. So nice and flat surface. So I'm going to add just a bit of water because usually the neck needs a bit more. Okay, and we'll do your other half after. So the neck usually can tolerate quite a bit more. The one thing too that I look for in my clients is what are their goals. So a lot of times we have the décolleté as a goal, and you can see through here the collarbone and then the trachea area in here. So we want to be very careful on there, not to put pressure. And it's very hard to go over the bone. So again, you want to pull the skin and then pull the skin so you can get the bone area without going on the bone. Okay, I'm going to do that. I'm adding water again for the slip. And again, I only have it at the first speed. This is a little more forgiving for how fast you're working.
Yeah, you more control.
Much more control, yeah.
You don't have to be moving as fast with your hand.
I'm really focusing on the evenness of the pressure, and my arm is on the bed as well. If you need extra support, I always mention to my students that they can put a towel to raise their arm so they have somewhere to put their hands, pardon me, their arms down. So my hand is here, but I'm really light on her trachea. And she does have a scar right in here. So I'm going to try to tighten the skin nice and taut and go over it. This is where you could up the depth, like go in a little bit higher number.
This area has a lot of sun damage.
Sun damage, yeah.
Your creases from sleeping at night.
And this is something, it's up to you if you're going to keep this as part of your treatment or not. The other thing I'd recommend is, especially as we age, is all in here is another spot that I like to do right on the neck. So I get behind the ear.
Is anybody asking for numbing that?
Oh, we'll get to that after.
I wondered if it was in the chat.
Yeah. There we go. Okay, just turn. Now you can kind of see a little more of the redness happening on Tara's skin. So afterwards, if there's any stickiness or left, you could do a little sweep, a little wipe. But we're going to actually just use a soothing style kind of mask that's hydrating as well to leave on for a few minutes. And then we're going to go to Q&A. Tara only gets half of her face done. Yeah, so the purpose of this, webinar is we're only doing half the face, so you can compare one side to the other. We'll give that a second to penetrate. So when we do clients, we actually do it like a mini facial. We'll have the mask on, leave it on for the 10, 15 minutes, then remove it. Maybe add a little more hyaluronic and a gentle cream. This mask particularly is a 2-in-1, so we could just send them home with it on their skin.
When we've done a superficial depth.
Yes. Yeah, we're talking superficial right now. Okay, so what I'll do now is, so we can get that close up, I'm just going to take the white out of the mask because then we can always reapply, Tara, if you need it.
I actually exfoliated last night. I used my lactic so that I'd make sure I had all the dead skin off my.
If while she's lying here that I do this, I'm going to take it off the stand and see if I can zoom in for you guys a little closer. So you can see the area that we did as we get into the cheeks. I'm going to just change my lighting. And her neck area. And if you go to the center, you go down the middle, you might be able to see the chin difference from one side and the other as well. And this is the blemish I was referring to that I didn't actually go over top of because it's healing. I think when Tara sits up, you'll have a better view as well. When we get into that upper cheek, you can see it starting to get a little more response vascularly as well. Okay.
Okay, we're back. So the questions, we'll move on to that. Okay, does it matter if this is for hair rejuvenation or regeneration?
For the depth, yes. If you're using other product. But I know some people are doing PRP on the scalp too, so then that makes a difference. But we get a lot of men coming in looking for treatments and derma rollers for doing on their head. But then the first question I ask them is if they're using any growth serum products with it. So that's going to affect the depth of the needle that they're doing.
And it's also going to be, what are they doing at home is always going to help because there's only so much being done in the treatment room. So they could look at different hair products for that. They would just have to not do it right after. If you're doing scalp treatments, maybe that's something you want to look into with the brands that you're using and get the recommendation from the brand educator on what would be the best protocols for that so it supports you in your treatments. What setting would you recommend for treating post-acne scarring? Treating acne scarring can definitely go higher in the scarring area because when you think about what happens with a scar in the skin, it builds and gets thicker. So in order to get the penetration of the microchannels under, you're going to have to work with the scarring. You can actually work with some peels in between treatments to help alleviate that as well. There's a few treatments. I know Patty from Twell has showed us amazing results with a client that she's been working with for, my gosh, it must be 10 years now. But the difference in the first few years, first you always have to, control and stop the acne breakout, and then the healing has to happen. But post-scarring, there's definitely results. You want to avoid blemishes, as I mentioned. I know we covered a bit. I know there's a question about blemishes. You never go over active breakouts or healing breakouts. You need unhealing happening. Like it's done, it's finished, and there's back to the base level. So go back to your treatment protocols that you offer in a facial to do that. Large pores, same idea. Like you always start with a little bit, and then as they're coming in for their treatments, you could start at like 0.25, see how they respond to it, and just monitor. I'd follow up with them the next day to see. And then when would you plan that next treatment as well? And if I'm not answering the questions, please feel to drop it in. I'll get in there again. What kind of serum do you use? We were using the A20 Hydrate Serum. And how do you select the gauges based on what's the goal, what's the skin, what's the texture, what's the thickness? So the thinner the skin, the younger the skin, the less of that rejuvenation, I guess you could say, then you go lower. The more needed, eventually you could bring it up, but I suggest through stages, just so that you don't get that opposite effect happening. Because a lot of times people say, I had microneedling, but I didn't notice the difference. And we've had pictures of, well, Tara, you've shared it, where a week later, her skin looks amazing after. And that's the idea behind it, right? Numbing cream, this is the one we were going to talk about too. So numbing cream, I don't numb because I'm not going over the 1.0. And if you are looking at numbing cream, there's a few things that, well, we've actually taken it from tattoo artists.
People are
and
allergic to lidocaine.
The lidocaine's a problem for a lot of people, and you don't know until it's being used. So I would suggest, if let's say the lip is the worst for this and they're super sensitive, you can only go to the gauge that they allow you to go to as well, even if you want to go higher. So if let's say it's the lip area and you want to numb just the lip, that's a very small area, but do a test first before using numbing cream on it. The other thing to consider is, does change the texture of the skin and what's happening. There's like an inflammation at the top layer of the skin that happens. So it's going to almost stop product from going in, because it's like an inflammation to the skin. So I just lowered the device down to allow my client to tolerate. The other thing is
not numbing too big of an area.
Yeah, don't do a big area. Do a little bit at a time if you can. Like I would do the face normally, and let's numb the lip or the eye. Be careful because that's coming close to the eye area. I don't know if I really numbed the eye area, but some people do. It's something that I want to work with my client to discover what's going on, because they're going to gauge me into what I'm able to do too.
Once you've worked up from a lower depth, their pain tolerance increases. They kind of get accustomed to the feeling of it, and you can go deeper without any numbing.
So the battery lasts quite a while. We haven't done back-to-back treatments, but I've done 4 in a row of clients, and we had no issues to charge that. And there still was battery the next day.
Yeah.
How long. It's based on how long you're doing it too, though. That's hard to give an exact.
And at the speed.
Yeah. And actually, I shouldn't even say that. So for example, a training day, we did a demo in the morning, and then students worked on each other. And then the afternoon, the student did 3 clients in a row. So it was a full day of 5 treatments with it. Hopefully that helps answer your question.
The brand was the 2L Super Soothe 3-in-1. And I like that one because it's a cream or a mask, so they can leave with it on. And depending on the time of day, we can put it on and then put sunscreen at the top. So
this is a question that I was hoping was going to come up about the light therapy, because we just chatted about that. But first, the sheet mask. Sheet masks, depending what the ingredient is, it should be hyaluronic focused, more for hydration than the vitamin C's and all those types of things. So think hydration after a treatment is better.
Yeah, because your skin feels tight. Like I can feel it tightening up already. Mm-hmm. And I usually the next day, even though I'm not pink anymore, I feel like I have to assist my eye in opening because it feels like the skin is tight around it.
And not in a bad way.
It's a good way. I'm like, means.
And light therapy. So this is a great question because it's been coming up lately on the noise out there on social media. At the level that we're doing, it's not a deep depth. So we have done red light therapy, not the other colors at all. It's all about rejuvenating. What they're saying about light therapy is that it's counteracting what was happening, because when we do microneedling, we're damaging the skin, right? So we want to make sure that with the light therapy, again, if you're generally at that 0.25, maybe 0.3, would be fine to do it after. But if you're going deeper and you're really working like on scarring and thick skins, that type of thing, allow the microneedling to do what it needs to do. And then you could have your clients at home do light therapy. But the first 24 hours, maybe just leave it be, depending on that.
And don't use blue light.
And no, it's red light therapy is basically the only thing. Again, 24 hours later, if you want for acne, if let's say you're working around different areas, but their acne's here and you're working on, tell them to locally, you're not microneedling that area anyways. That would be the blue light.
So my thought behind it, going back to the PRP, first of all, it's out of our scope. You have to be nurse, you have to nurse practitioner, have a medical director or whatever to be drawing blood and then doing that. And it speeds healing. But first of all, it's not our scope of practice, and the skin's going to heal anyway. So there's not that much downtime that we're trying to speed up the healing. So let it do its process. It's still going to do its thing. And the same thing with the red light therapy. It's speeding, it's helping the product penetrate, but really we're only putting hyaluronic at a deeper level anyways, and speeding the healing, but it's going to do its thing anyways. For me, if someone's insecure about leaving too red, the red light will help calm the redness down a bit. But again, it's going to heal. Do we need to speed it? It's going to do its thing. Just let it.
Yeah.
I mean, we're causing the mini traumas for it to heal itself and rejuvenate itself. So you don't have to have the red light.
So in the consultation, I guess that's something you can talk to your clients about, saying you might be red after.
And the scalp too, with rejuvenating the follicles, it helps with that.
Can you use different needle points? This is the only cartridge designed to use in this right now. It's the 14 gauge.
There's other cartridges, but this is the only one that's Health Canada regulated. So it's the only one.
Oh, the one
we have
used
here,
yeah. Right. Mm-hmm. And price point of the Dr. Pen and service pricing, packaging recommending.
So the Dr. Pen is listed at $9.50 and you get 20 cartridges. So through me.
Yeah.
And then, so then when you can buy again, the package of 10 is $50. So they are $5 each is your cost of goods per service. And so then I know some people that have invested in a $6,000 device and the cartridges are $60. They're charging $400 for their treatments. This one, my rule of thumb is try to stay within like 10% as your cost of goods. So
and your time.
And your time. So
and what are you actually doing in the treatment as well? Mm-hmm. There's some people being really creative and giving them a post-treatment kit to take home, but they're adding that into their whole cost to be exclusive, like little different things, be creative with it. So then they're using the right products for aftercare. Aftercare is going to be a little bit about, okay, what's the goal and what does the skin need? So if you know they're dehydrated, it doesn't matter what the amount of treatments you're going to do on them. If they're dehydrated, they're not going to get the same results on a hydrated skin. So always focus on the hydration of the skin as well. Hopefully that helps.
I read yours, Jerry. We have a few people with really expensive devices, and those treatments are more exclusive, I guess. They have the clientele that will pay for those treatments, want those treatments, and then they've kind of priced themselves out of the market for most other people. So this way they have both. Mm-hmm. So like I said, scar revision on like teenage skin that they were maybe cutting, or incorporating it into a treatment.
Or older skin from when they were teenagers.
Or doing it on yourself, like me. your skin kind of gets accustomed to it. So I have a derma roller at home that I use in between treatments. And if you're doing it at a superficial depth, you can do it more frequent. So then those clients that are willing to come more often, you can do a superficial depth that's treating the fine lines and pigmentation. And then if they're wanting the deeper wrinkles or they have other goals in mind, more the lax skin, then you can spread those out 6 weeks apart, but do the superficial depth in between. So you're now just opening up what you can do.
Yeah, sometimes it's confusing to what people are saying out there. Only do microneedling every 4 weeks because allow the microchanneling. It depends on the depth of what you're doing. If you're going superficial, you could do a little more often. So think of it like peels. If you started off with a 40% glycolic, you can't do another peel for a very long time, right? But if you did a light peel or light exfoliation and built the skin and slowly developed, it's not necessarily you have to increase the percentage or pH of the peel. If you're doing it more frequently, you're allowing the skin to do that cell renewal and come up. And that's the whole idea, right? Is to work with the dermis of the skin so that it's, creating the fibroblasts, encouraging the collagen and elastin to move up, and then exfoliation to slough off. And then you're going to get the newer skin.
And not disrupting it when it's in the middle of it.
Right.
Of where the depth you're hitting.
We've done it on ourselves. Like we like to be guinea pigs quite often. A week apart, superficial, have had no issues at all. But again, that's superficial. We've done it, I think it was a while ago now that we did it a long time ago, and we went quite high. And we couldn't do anything for like 6 weeks, 2 months. We decided not to, just allow the skin to be on its own and heal.
To do it. Yeah. But even at I've done both, and even at the superficial depth, like the tightening of the skin, my worst angry line right here, how it's reduced and how long the results last. If anybody's come in here, my one thing I say is I had done a series of chemical peels for the muddying complexion, the pigmentation marks on my cheek, a superficial microneedling session on a Monday, and how significant the results were by Friday. That was one of my first treatments. It was incredible. So,
and I don't know if you guys heard her say that yesterday she decided to do a light lactic exfoliation just to have this. If you want to do an exfoliation, we have done it, but very light, like enzymatic.
Don't irritate
not a chemical enzymatic. I'm talking your general one where you add water to it and it's just going to take off the only the dead skin that needs to come off.
And the idea behind it is you want to have a good surface for microneedling at that superficial depth, because you don't want to be wasting that depth going into dead skin on the surface.
Again, when it comes to deciding your treatments and that, there's a lot of factors involved with it, and treatment protocols. It depends on what the goal is, what is the client's goal. And there's no one answer to this. It's a puzzle that you're going to have to work with your client. Like, how often do you recommend a facial? How often do you recommend an exfoliating facial or a hydrofacial? Like, there's protocols to it. How does it fit into the regime of your client as well?
My must-have aftercare is hydration, like pumping hydration into the skin. All those microchannels are ready. You drink in the product so much faster. And like I said, it feels tight. So you just kind of want to just encapsulate it with moisture. And
that's actually why we use the Super Suit, because it's hydrating, calming.
So I don't know if you guys can see, but
the redness is a little bit blotchy, but it's gone down a little bit.
Yeah, in an hour or so, you won't even probably know what I've
When you're using other devices, other equipment with this, think less is more. A hydrofacial on your own it can be an aggressive treatment already. And that purpose behind that is like a microdermabrasion. You're just adding water to it. So it's a heavy exfoliating treatment. Yes, you're putting water in, but maybe you would do that a week before the treatment, before the micro, because it's really hydrating, what you want for the skin. or a week later do that hydrofacial. But
Because we do,
combining together, we've seen combining, whether it's chemical peels, all these other treatments, but really you could just keep it simple. You cleanse, you tone, maybe an enzyme peel, you microneedle, you do a mask, you do LED if they don't want the redness, you want to calm it down because they're going somewhere, that's fine. But if less is better, let the skin do its own thing. And that's it for a treatment, really.
and then we have the Quattro treatment where we do radio frequency and lymphatic drainage
Superficial.
on superficial.
On superficial only, though. Yeah. Aftercare for home instructions for sure. Some people are getting creative, Caitlin, with putting it part of the package deal. So they're buying a series of 3. They're going to see you depending on the goals, every week or 2 weeks or 3. Here's what you're going to use for aftercare for the first few days. But again, what's the focus? Hydration will be the first one after a treatment, and even maybe for a few days actually. And then they might start to incorporate other things into their skin. That's when you could do the vitamin C as well afterwards.
And galvanic, we have those
Galvanic
ultrasonic
meaning
skin scrubbers. So we'll do a lifting massage with that.
Yeah. Are you referring to like a lifting galvanic, or how are you using the galvanic? Galvanic machine does a few different things. So can you tell us, how do you use your galvanic machine? Is it iontophoresis? Is it cataphoresis? Is it lifting? Is it cleaning? Are you putting in product?
Yes,
iontophoresis. So putting in with your serum? Yeah. Okay. We're way over time. Thank you so much for staying. I really appreciate that. Maybe we have to
email us any more questions.
Or a part B. We could do a live Q&A or something. That would be fine too. But thanks so much, everybody. I hope you enjoyed it. We'd love your feedback too.
Thanks a lot. Have a good one. Bye.
Bye, everyone.